Hey guys, this is Dr. Sarah Morter Rowden, and I'm here today with Miss Vivian Dunaway. Miss Vivian presented to our clinic a few years ago, and I'm going to let her tell you about what she had going on when she very first came in to see us.
Well, when I very first came in to see the clinic, I had a severe left knee problems. My knee was popping in and out of socket. And so that was quickly addressed, and I don't have that anymore. But then I happened to mention one time about my hands tingling. And I had mentioned this, I didn't share this with you, but I'd mentioned this to my traditional doctor
Okay.
before. And so they were looking at carpal tunnel and, those types of things, never really looking at where the root cause of it was. So I happened to mention it to the doctors, and immediately they respond and they're interested, which was a blessing, for me. But so anyway, that's when we determined that it might not just be, the source might not just be here, but might be in my neck.
Mm-hmm.
So that's when y'all proceeded to sit down with me and talk about what you recommended, and
Absolutely.
went from there.
So we sent Miss Vivian out for some x-rays, and we got some images done of her neck, and we were able to determine that she had a loss of the curve in her neck, as well as some degeneration and some compression on her discs. That compression was putting pressure on her nerves that were traveling down her arms, which was contributing to the numbness and tingling that she was feeling. So at this point, after about 6 months of really working on your neck, what % better would you say your neck is?
Oh my goodness. That's hard to put percentage on, but I'd say 85–95%.
Excellent.
Oh my goodness. I wish I would have kept records as to when that
Yes.
tingling because it was disruptive to my lifestyle.
Absolutely. You do a lot of pottery and
A
art
lot of
and that kind of
pottery
thing.
and waking me up at night. I don't have that anymore.
So there's no numbness or tingling in your arms at this point.
At this point, no.
Awesome.
If I'm away from you like I was a couple of weeks, yeah, I can tell a little bit difference.
Okay.
But no.
So we're not completely done with her care, but we are well on our way. And thank you for sharing with us today, Miss
Thank you.
Vivian.
Appreciate all of y'all.